Hi everyone, Aran Hammy with WLIO in Lima. My question is for the governor and lieutenant governor. If we could return to the face masks, face coverings once again. Many on social media right now are saying that they think this is ineffective. How are you recommending to the businesses to enforce their rules within the stores, and how they should go about people who are refusing to wear them inside their stores?
Well, Dr. Acton talked about the effectiveness. I mean, we've talked about this a lot up here, and it's more, my understanding, it's more you're protecting the other person, and the other person is protecting you. So if a clerk in a store is wearing it and the customer is wearing it, then they're protecting each other. Ultimately, it's going to be up to the store, to regulate that. Ultimately, beyond that, of course, is the health department. But look, we're not about trying to make things onerous just to be doing it. We're trying to be able to protect people. And so what every person who I have talked to who understands the science behind this says is you do the social distancing, and if you add in that both people or all people have some facial covering, is you dramatically increase your odds of not getting a virus if one of those people happens to be shedding. One of those people happens to be contagious. You're just significantly increasing your odds. And so we have a small environment, or maybe a bigger environment in the store, depending on the size of the store. But it's not just for the protection of the person who's wearing it. In fact, it's more for the protection of other people. And if you require in that setting, in that business setting, that both parties have that, then you've added to that protection.
I will add one thing, and then I'll throw it to Dr. Acton to talk about the effectiveness. But this is the feedback that we got from businesses when we were having this conversation. They said, we want him because we want to go faster. We want to get through this. We know that this is an effective tool so that we can slow the spread. And they also are worried about it and they like the idea that we require it so that it's not necessarily on them to do it, because they don't want to have flare-ups in their own businesses. Because they know in many cases that if that happens, then they're going to have to shut down, or it could spread and it could be very disruptive. So many of the things that we're asking in here are already being effectively done in businesses that are operating, and those are the best practices. That's what they encourage that we do, because we all just want to get through this. And these are the temporary things, as the governor mentioned, that we can do to get through this so that we can, move on to a less restrictive way of living. Dr. Acton?
Thank you. I want to agree with all of that. I think we want to empower you as an individual to have the tools you need, and we're trying to help businesses as well have the tools they need. And, this mask is, again, I feel people's pain on this one, because I'm one of those people that has a fan going at night and wants lots of air movement. And so, in other cultures, this has become a symbol of courtesy to each other, care for each other, because they realized, having gone through a few of these epidemics of similar viruses, that this made a difference. And so we know this is the science is showing that it makes a difference. It is an asymptomatically transmitted virus, so I might be carrying it and not know it. And what I do might affect somebody else who doesn't have the opportunity to go back at work, because that worker now takes it home to a spouse who's already sick or a child who's already sick. So this really is going to be one of those collective things that I myself have to keep putting around my neck and reminding myself that what I'm doing is bigger than me. It's for all of us, and it's helping us move forward and move our economy forward.
Good afternoon, Noah Blundo with Hannah News Service. I have a question about the contact tracing workforce. First, the numbers you specified, were those in addition to the local health workers and volunteers, or inclusive of them? And then what kind of clinical skills and language skills and other skills does someone need to be able to be part of this workforce?
I'll start. My understanding is that the 1,750 is the total, which would include what health departments already have. Health departments, as you know, do this every day. They just don't do it in as big a scale. So we'll add to that. They will hire more people. We will have some people to surge in, and so that's where the 1,750 will come from. As far as the skill set, I think it's important that